Hello, welcome to another case study. So this is a case study on one of the obstetric cases. So the questions are: the presentation is called what? The attitude of the fetal head is. Then the engaging diameter is. So it measures. Then what is the denominator? Then what are the two positions for this presentation and the mode of delivery for each? Okay, so for the answers, the type of presentation for this one, as you can see, this is the first presentation. Then the attitude of the fetus is called hyperextension. So as you can see, there's a hyperextension. Then the engaging diameter is submentobrygmatic diameter, and the submentobrygmatic diameter is about 9.5 centimeters. Then the denominator is the fetal chin, which is the mentum. Okay, that's the denominator. Then two possible positions for the presentation and mode of delivery for each. So we can have a left mentum anterior, which is the most common, and of course this one, vaginal delivery plus forceps delivery can be attempted. Then we can have a right mentum. We can have a right mentum posterior. We can have a left mentum posterior. We can have a mentum transverse. So for 2, 3, and 4, so meaning the right mentum posterior, the left mentum posterior, and the mentum transverse should be delivered by C-section. So okay, so that's the end of the tutorial. And usually in our cases, in our case, if it's a first presentation, we don't necessarily even try, even if it's a left mentum anterior, we don't necessarily even try to do a vaginal delivery due to the complications. We want to avoid the complications by all means. So we just opt for a C-section. Okay, but just follow the hospital guidelines. And thank you for watching, and see you in the next case study. And please subscribe to the channel, and also check out other case studies as well.